Hi everyone, welcome back to Toolkit Talks. My name is Jennifer Smith and this is video 2 of 3 for our Toolkit Talks Joy in Work video series. Again, I am a public health resilience coordinator with CoCares. That's the Colorado Alliance for Resilient and Equitable Systems, and the Office of Public Health Practice, Planning and Local Partnerships at CDPHE. I am an e-learning developer. Again, this is the toolkit from NACCHO. They are the ones who created this Joy in Work toolkit. So they stand for the National Association of County and City Health Officials. They created this toolkit from the white paper that was created by the Institute for Healthcare Improvement. They created the framework for improving joy in work. So again, it's kind of 3 levels. So you have the white paper and the framework that IHI created, you have NACCHO's toolkit, and then you have this video series kind of following up from Joy in Work. So use the QR code, go to NACCHO's website and download the toolkit if you haven't already done so. So what are Toolkit Talks? We, again, are not doing anything new. We are taking something already created from one of our partner organizations, something that we think is very valuable and useful, and we're just breaking it down into a video format. Sometimes it's easier to listen and watch and hear from other people instead of just taking a paper or a PDF and then going, okay, we're going to implement this. It's good to have this training and information done in just many different ways. So following along with the toolkit, watching the videos is the best way, I think, to learn. If you haven't already watched video 1, please do so. That is in the playlist. We went over the introduction, the purpose, the principles, and then how to get ready and prepare for these conversations and bringing joy in work. And then today, video 2, we're going to be going over step 1 and step 2. So step 1 is asking staff what matters to you and having those conversations, starting the conversation. Step 2 is identifying unique impediments to joy in work in the local context, meaning finding barriers, what's getting in your way of implementing this toolkit. And then the last video, video 3, step 3 is committing to a systems approach by making joy in work a shared responsibility at all levels of the organization. So how are you going to make sure everyone's taking responsibility and creating your team of people? And step 4 is using improvement science to test approaches to improving joy in work in your organization. Let's get started. Step 1, ask staff what matters to you. How do we build and/or repair trust at work? Employee trust must be earned. You have to be open and honest about changes that will impact your staff. Effectively communicate by talking with staff, not at them. Have an open door policy and follow up. Be willing to pitch in to help. Earn trust through self-reflection. Take accountability for restoring trust instead of waiting for someone else to change. See the other person in a new light as though they are trying to do their best. We each believe our view or version of a situation is the truth, so accept that their view of the situation can also be the truth, even if it conflicts with yours. Give up a bit of your ego to just listen with curiosity. It won't be easy. Trust is a big thing. If you do not have trust already with your employees and with your team, the Joy in Work Toolkit can really help you actually repair that trust because you are doing all of these things, especially if you've done the pre-work that we talked about in video 1, where you're looking at yourself, you're looking at your emotional intelligence, you're making sure that you understand what active communication is and what good communication is in general. When to have the conversations. Joy in work really is about having conversations and communicating with your team and listening. You can have these conversations in your huddles. You can start or have communication boards. You can do a survey. You can have these conversations during regular staff meetings. And then you can also schedule more informal meetings that are maybe just very, very quick little conversations you have in the hallway. It could be just you have some meetings just about the joy in work. The conversation. By identifying the components that contribute to a bad day, leaders and colleagues share the problems and ultimately the solutions. This creates a sense of, we are in this together. By asking the questions, what makes a good day for you? What makes you proud to work here? When we are at our best, what does that look like? These questions set the context for asking what gets in the way of a good day or what makes for a bad day. The conversation establishes a place to start to make the work environment and community work better. Even if you can't take immediate action on every issue, identify assets and bright spots on which to build, as well as things that need improvement. Work together to facilitate change, build relationships, and employ a participative management style. You're just starting to have these conversations at this point. You're getting information, you are listening, you are hearing people, you're taking this all in, you're working as a team, you're building these relationships, you're improving trust by talking to people, and you're starting to work to make change. Here are some things that they recommend to do. Ask a colleague who is trusted by others to co-lead conversations at meetings. This can be anyone. This can just be an employee that you know people trust already, especially if you haven't built that trust already. It's really great to find somebody that people are already really trust in. Use brief huddles in the work area to have conversations with as many people as possible. Articulate why you are talking about joy in work. This will help people understand what you are trying to do. It will build that trust in that you are trying to make changes for the good. Talk about the purpose of the conversation and why you are interested. Why are you asking these conversations? Why all of a sudden are you having these conversations with people and bringing these things up? Emphasize this is about ongoing improvement, not a one-time or quick fix. Sometimes I think that's what employees are worried about, is this information is going to go nowhere. This is maybe a one-time thing and we're going to forget about it, or maybe it's a quick fix, but maybe that quick fix even fades away after a while. And start by sharing a story about what matters to you. Why are you doing this? Why do you want to bring joy in work? Build on assets and bright spots with these topics. Why I decided to work in public health or nursing or whatever the field is that you work in. What makes me proud to work here? What matters to me in my work is, what is the most meaningful or best part of my work? This is really great. It's great conversation starters. It's also leaning on the positive and the bright spots, as they say, because you want to kind of start there first and hear the good, because it will automatically, I think the negative automatically comes out, but we don't want to just go down sort of the spiral of negativity. We also want to build on some assets and build on the good things that we're already doing. So steps to try on building on assets and bright spots. So how do we do that? Choose one question to get started, then listen and invite others to comment. Keep it simple. You don't need to throw out a bunch of questions. One question could do for one meeting. Ask follow-up questions and clarify statements. So use your active listening skills. Point out when bright spots are similar. Identify the themes that you hear. Capture what you are hearing so it is visible and posted in a location so all can see. This isn't a secret. We're doing this as a team and we're conversating. I'm sort of sometimes a listener, and then I kind of have to think about it and get back, and maybe I'll have some ideas later. So, having a posting spot, maybe even where people can make comments or put sticky notes later as they're working and passing by this poster, maybe that's in the break room, and it can build even more conversation. Step 2, identify unique impediments to joy in work. Identify the barriers and challenges to joy in work. Make sure you're implementing joy in work with equity. My favorite picture here of equality and equity, where people are on the little step stools reaching for something the same height. Love this graphic. Make sure everyone has the opportunity to be heard, to give input and have these conversations. Again, maybe not everyone can attend every meeting, so make sure you're giving everyone the same opportunity to give input on the things that you're discussing, even if that means you might have to just adjust the schedule and the conversation times. Ensure you are speaking with every staff member, not just clinical staff. These changes that you're trying to make, joy in work, is important to everybody. So wherever they are working in the organization, wherever you're trying to make these changes, make sure everyone has input and is able to be a part of this conversation. Don't leave anyone out of the conversation. That is definitely not a way to build trust. Hold meetings when everyone can attend and record them. So if somebody can attend a meeting, obviously you can record it, you can take meeting notes. Even holding, one-on-one meetings with people who can't attend, maybe that's something you have to do. Whatever you need to do to make sure everyone is being a part of this and everyone is being treated with equity in these conversations, you need to make sure that you're doing that. Equity means meeting communities where they are and allocating resources and opportunities as needed to create equal outcomes for all community members. Equality means each individual or group of people is given the same resources and opportunities regardless of their circumstances. So make sure you understand the difference between equity and equality. And we are going to watch just a quick video here from the Institute for Healthcare Improvement. They have a ton of wonderful videos, so we'll take a look here.
If you find that you're putting the money forward, finding the resources forward, but you're not able to find people that are willing to work on this with you, then you've got a challenge of trust likely in the system, and that you'll need to work on creating a psychologically safe environment for people to work on these issues. And to my mind, that requires you to listen differently to your stakeholders, whether it's in your community environment or within your staff and your community. It's listening actively and differently than you've listened before. And then to act on what you find. So to listen and then to act based on what you're hearing, and then to not expect anything in return for some time. I don't think these cycles of trust and distrust are only broken by consistent application of listening and acting and then repeating over and over and over again, so that people know that you're serious about your commitment to equity. And in many ways, I'll say that this has been the story for IHI. This won't surprise anyone from the IHI, but this is a lot of our story, is listening and trying to act on what we hear and doing so over and over again. And we stumble, and you will stumble as well, and you will stub your toe or trip at different points in time, and it will cause for some sometimes a disconnect or sometimes a misunderstanding about what the intent was around something. But if you listen and you act and you do so consistently and repeatedly over time, then trust eventually gets built in a community. And if you bring the necessary resources to support your stated value around equity or your stated strategic initiative around equity, then once again, I think you're acting in a way that's consistent with what you say matters to you. So listen to hear what matters and then act on that in a way that I think is compelling, and do so over and over again, because you won't build trust with one cycle of listening and action.
Okay, great video from IHI, who created the framework for joy in work, talking about trust again, talking about psychological safety. I think also just making sure that you're proving to them, the people in your team and your organization, that you are listening and you are trying to make changes. And again, it's just do as you say and say as you do kind of a thing, right? So say what you're going to do, act on it, and people will see that you're actually really doing what you're saying, I think is the biggest thing, because people have been let down, I'm sure, before in management. Again, they hear something, nothing really happens with it, or they give feedback but nothing really happens with it, and we want to make sure to break that cycle. So challenges. There can be a lot of challenges when you're trying to implement joy in work. Trying to make any changes, you're going to have pushback and you're going to have negativity. Here are some things to do with negative team members. So those are those who complain but don't participate in identifying solutions. What can you do? Emphasize what staff can do together to address impediments and barriers. Use the improvement science methods and tools, which we'll discuss in a later video. Initiate the what matters conversation with colleagues. Having simple conversations can really do a lot for negativity. Spend time truly listening. Using those active listening skills, again, it will really show that you are listening and you're paying attention. And then clarify what you heard. So make sure you are clarifying that you're hearing people correctly. A big part of active listening is just actually really taking it in the information and making sure you're hearing it the right way. And then add the barriers identified to the notes. So make sure none of this is hidden. Everything's transparent. They have all the notes, all the barriers, all the impediments that you found, all the issues that you've found through these conversations. Make sure you're writing it down. And I think too, getting back with people about that. Like, so if you're trying to work on something and you're having an issue with maybe fixing something that somebody thought was a problem, just keep bringing it up and let them know I am working on it. It's a little more difficult than I thought. It's going to take a little bit more effort, but I'm not forgetting that this was discussed. That even just showed that goes miles with people for sure. So again, the purpose of the conversation. What is the purpose of the conversation? We're asking the team to share what gets in the way of what matters. What gets in the way of a good day? What frustrates you in your day? Things not to do. So don't assume all team members will understand what you're talking about immediately. They are often not used to being asked what matters. Don't assume all will feel safe talking initially. It might take a little time. Don't assume all have the same view. Don't mandate participation. Instead, welcome and invite, right? So even if it's a mandatory meeting, they don't necessarily have to participate and say something. Just welcome them, invite them. Maybe they're just listening and taking it all in at first. And definitely don't speak for others. Make sure everyone has a turn if you're trying to get opinions, even if that they want to come to you later in private or something. Just make sure that you're making sure you're not speaking for people, even if they're quiet. Okay, well, that was a very, very quick video today, but a lot of great information, really trying to start the conversation. Why are we here? What are we asking you? Make sure you're transparent. Make sure you've already built back up some of that trust. You understand how to build psychological safety, and then as you have these conversations, you will build even more trust. You'll get rid of that distrust. You'll add more psychological safety. Make sure you're having equitable conversations, that every single person is a part of the conversation. It will help reduce the negativity that you're going to have, any pushback. Change isn't easy, even if it's for the best, but I think once you're getting used to having these conversations and being open and honest with each other, it's really going to go a long way. So this second video is really mostly about having the conversation, how to do that, and steps to help you along the way. The toolkit definitely has much more of the try this, don't do this kind of a thing. So if you check that out, they have a lot more. We couldn't put it all into our video, but they have a lot of information in the toolkit. So make sure you're downloading that. And thank you so much for watching. You can contact OPHP training team at ophp@state.co.us, and I am a part of that team. You can use the QR code here to access our training website, mostly for local public health, but I'm sure everyone can probably find some kind of value in a lot of our training that we have on the website. So please check that out. Reach out to us for any questions, and then we look forward to seeing you at our next video. Video 3 will be the finale, the last two steps of the Joy in Work Toolkit. So thank you so much, and we'll see you then. Bye-bye.